Your intervertebral discs have no direct blood supply. That single anatomical fact explains more about why back pain develops and why certain exercises work when others do not than almost anything else in spinal physiology. Because discs have no circulation of their own, they depend entirely on movement to survive. The alternating compression and decompression of normal spinal motion literally pumps fluid and nutrients in and out of the disc tissue, a process called imbibition. Sit still for 8, 9, 10 hours a day, which describes most Malaysian desk workers, and that pumping mechanism is largely absent for most of the working day. The discs compress and dehydrate progressively, losing the water content that gives them the cushioning capacity under load. The facet joints between your vertebrae, which also depend on movement for synovial fluid distribution, stiffen from the same lack of stimulus. The muscles running alongside your spine start to guard and shorten against the static posture without you noticing. By mid-morning, your back already moves differently than it did when you woke up. The cat-cow stretch was designed specifically to reverse this, and it does so through a direct mechanical mechanism that is well understood and well supported by the evidence. Here is how to perform it correctly, because there is a version that works and a version that merely feels like exercise without providing the therapeutic effect. Start on your hands and knees on a mat or firm carpet, wrists directly under your shoulders, knees directly under your hips, spine in a neutral flat position that neither sags toward the floor nor rounds toward the ceiling. Begin the cow phase. Inhale slowly through your nose as you allow your belly to drop downward, your chest to lift forward, and your tailbone to rise. Take 4 full seconds to reach end range, not 3, not 2, because the slower the movement, the more of each spinal segment gets progressively mobilized. When you reach the end of the arch, pause for 2 seconds and check whether you can feel the movement in your upper back, in the region between and below your shoulder blades. Most people doing cat-cow for the first time feel it exclusively in the lower back, and that tells you something important. The thoracic spine is not participating. The thoracic vertebrae, the 12 that attach your ribs, are routinely the most restricted region in people who work at desks, and they are routinely the segment that most needs daily mobilization. Consciously try to extend the arch into your upper back by thinking about your sternum lifting forward and away, not just your lower back hollowing. If your upper back feels stiff and resistant rather than opening smoothly, that resistance is useful clinical information about where your spinal mobility work is most needed. Now, the cat phase. Exhale slowly through your mouth as you round your entire back upward, tucking your chin gently toward your chest and drawing your lower abdomen in slightly as your tailbone tucks under. 4 seconds up, 2 seconds hold at the top, and again check that the curve is traveling through every level from your tailbone to the base of your skull. Return to neutral and go again. 10 repetitions is your minimum. Slow, deliberate, always breathing with the movement and not despite it. The breath coordination is not incidental. The diaphragm shares fascial connections with the deep lumbar stabilizers and the pelvic floor, and when you time the inhale into cow and the exhale into cat, you activate the entire deep stabilizing system as part of the exercise. A version done while holding your breath recruits completely different muscle patterns and loses most of what makes this exercise clinically valuable. After your 10th repetition, walk your hands slightly forward, then sit your hips back toward your heels into child's pose and hold for 30 seconds, letting the lower back and posterior hips release without any effort on your part. Then roll slowly up to standing. Total time, 3 minutes. Morning is the best time to do this before you put any vertical load through your spine, because your discs rehydrate slightly during sleep, and the mobilization is more effective when discs are at their fullest hydration. If you work at a desk, add 5 standing repetitions every 90 minutes. Stand, place your hands on your lower back, and slowly alternate a small extension and a small forward bend. For everyone else with general back stiffness and no leg symptoms, consistent daily practice produces measurable improvement in how freely the spine moves within 2 to 3 weeks. The full guided demonstration with physiotherapist technique cues is in the link in the description. Watch it before your first session to get the technique right from the start, and then do it every single morning without exception.